Trump tweet not signal to abandon Senate health care bill, White House says. The White House is denying that they've moved to Plan B on health care after President Trump suggested repealing and replacing Obamacare separately, instead of simultaneously, on Friday. The president hasn't changed his thinking at all, Deputy White House Press Secretary Sarah Sanders said Friday during the White House briefing. Senate Republicans delayed plans to vote on health care legislation this week after not securing enough votes even to advance it procedurally. Senate Majority Leader Mitch McConnell, RK, has said he now expects for the Senate to vote on the legislation over the next few weeks. On Friday, Trump suggested splitting the legislation up. If Republican senators are unable to pass what they are working on now, they should immediately repeal, and then replace at a later date, Trump tweeted. Asked about Trump's tweet, Sanders argued the administration's plans for getting a bill passed haven't changed. We're still fully committed to pushing through with the Senate at this point, but we're looking at every possible option of repealing and replacing Obamacare, she said. We are focused on doing that. Added Sanders, we're not focused on Plan B. We're focused on the overall process of repealing and replacing Obamacare. Sanders also declined to say when they hope to have the legislation passed. As we've said before, we're less focused on the timeline and focused on making sure we get the best deal and health care plan possible, she said. Sanders was asked to discuss the president's position on what the legislation means for people on Medicaid. The CBO analysis released this week said Medicaid enrollment would fall by 16% over the next 10 years. I think the president is again very focused on protecting those that are currently in the program, Sanders said. That's certainly a big priority for him, is making sure those people are protected. And also adding additional resources. That's part of the Senate bill as it currently stands. And that's something we'd be most likely supportive of doing.